Good morning, good afternoon, good evening. Welcome to episode, I have no idea. I think it's episode 19 or something crazy of Might Help, Can't Hurt. Conversations with leaders, doers, and friends. And
occasionally family.
Leaders, doers, friends, and family. Yeah. Well, there you go. So yeah, as you may have worked out, I'm in conversation today with my brother, David Glazer, who is, among other things, the founder. I think the most impressive sounding thing to me as a layperson in your bio was founder of the Google Genome Project. Tell me, start there. Like, what were you thinking?
I was thinking this sounds interesting. Was really what I was thinking. I had was coming off a project I'd spent a bunch of years on at Google, and I was ready for a new thing. And one of the nice things about a big company, Google in particular, is you get to change jobs without changing companies. Right. So I did what people usually do is I had lots of lunches, and I said, "What are you working on? And who do you know that's working on something more interesting than that? Because that sounds boring." And did that a few times, and ended up having lots of great lunches, lots of great conversations, and getting connected with some people and finding a project that nobody was working on, but that I thought we should be working on, that I was excited about. And the idea was very simple. The amount of data that's being generated by biology was growing way faster than biologists were used to working with.
Right.
And Google had tools for working with lots of data that had evolved, to keep track of cat videos and other important things. Yes. And we could apply those tools to the data from biology. So, my internal slide deck said, here's life science, here's data science, there's an overlap, we should do something in that middle. And that was about as much as I knew about the space, but it was enough to get some internal funding to start a small team, and we jumped in and said, let's start learning and figuring out what we can do that's worth doing.
And how much did it change as you went? Like, how much did what you wound up doing was just exactly kind of what you thought you'd wind up doing, and how much did it?
No, it changed. I mean, I guess at the very high level, we're still doing exactly what I thought, although the boxes and the labels and the teams have moved around, which is that life science, data science intersection, take the tools that have evolved to work with large amounts of data in other contexts and apply them to new large amounts of data in biology. So that's spot on. In terms of the specifics, I didn't know enough biology to know what actually needed to be doing. And we started this in 2013. The biology's changed. We were right that the amount of data was exploding, and it has exploded, and that makes things hard to predict.
No, so that's interesting, because logically it would seem like more data would make things easier to predict.
It makes more data is incredibly powerful. It makes it for predicting things about biology. It makes it a lot harder to predict what the tools need to be.
I see. Okay. Yeah. That makes sense. Yeah. That makes absolute sense. So no, this is, I'm going to butcher this, but that's good, because then you can put me right. One of the talks I remember us having on like some Thanksgiving family hike was you were explaining how the relevance of the data in cancer research, and I'll do the précis version as I remember it, and you can say what you might have really meant. But was that, if we have a cancer treatment protocol, an experimental protocol, and it seems to work with less than 10% of cases, it would normally be dismissed for extra funding, because you can't just invest in everything just in case. But that with enough data, you can start to identify that there are maybe 150 variations on the cancer, and maybe that one treatment works 100% of the time with one of the variations. And so suddenly you can literally wipe out an entire type of cancer through data. Is there?
Yeah, no, that's exactly right. That was well summarized. It's an analogy I don't think I used at the time is, if you were having a little bit of trouble reading and you went to the eye doctor and he said, "Here, glasses," and you said, they, for most people, they didn't work very well. They either got a little bit worse or not enough better. You would not think that was a very good doctor. You'd say, hey, how come you're not treating my eyes?
Right.
And the same thing applies to various diseases, cancer most particularly, because cancer is each cancer is its own thing.
And did you go after cancer on purpose, or was that just one of the areas where it
was no, that was just one of we support people who do science and understand the biology, right? We're not trying, one of our taglines for some of our products is focus on your science. We're trying to get it so the people who are doing the research and know what questions to ask and what data they need can get right at that. We want to be the clear pane of glass through which they see their data, not the, oh, cool, look at that.
So then you're, in that sense, it's not so much that you are trying to cure cancer, but you're just providing something that will make it easier for the people who are trying to cure cancer to do.
That's right. That's where I have gravitated to in my teams. There are other teams. There are some other teams at Google that work higher in the stack and do some actually. We're doing interesting novel research on particular things like diagnosing eye disease before blindness occurs.
Right.
There are people at Google doing that, but there's way more people in the bigger world, and we're trying to help all of them.
Right. So, I mean, I'm going to ask this in a weird way, but it's the way it's coming up in my head. Like, where do you get the balls to take on something like that? Like, that feels like kind of a huge undertaking.
It is, and I think there's a good and a bad answer, right? And they're mixed. And most of the people I know in tech have a bit of both. Who gravitate to this space? Yeah. And one is it's worth doing, right? Yeah. If not me, who? Right? It's like this is an area where I have skills, and it's not about me. This is an area where we as an industry have a bunch of people and a bunch of tools that can make a difference. So we should. Right. Yeah. It's like, and hard isn't really the right question. It's right. Possible is the right question. So that's what I'd say is the good half of what attracts people. The bad half is hubris. The bad half is, oh, how hard can it be? We're smart. Right. And the parts of the tech industry have earned a bad reputation for saying, "Oh, how hard can it be? We'll take care of that for you," without understanding it well enough. So you have to come at it with the right mix of we know what we're good at, and we know we're really good at that, and we know what we're clueless about, and we know we're really clueless. And then and what I have found works best is partnering with complementary expertise. Right. So, one of the things that we got right in the early days was building some partnerships, finding some of the people out there who I continue to work with today who are experts in their relevant fields, and really combining what we're good at so that I am helping build tools to answer the right questions. Some of the first tools we built were beautiful tools that didn't actually address common needs. So, yeah. And of course, you can't know that till you're. Yeah. How has it? Okay. I don't know if you heard, but there's this pandemic going on. Oh yeah. Yeah. And so how is that kind of massive data collation organization? How is it helping or not as relevant with what's going on with COVID? It's already helping in some pretty clear ways, and I think there's the promise of it continuing to help. I think one of the things that people are doing to understand COVID is saying, hey, how does it affect different people differently, and what can we learn from that? Right. And I'm going to back off to put that in a general context and then zoom back in to talk about some of the things people are doing with COVID. There's one of the organizations that I get to spend some time with is relatively new. They're called ICDA, the International Common Disease Alliance, icda.bio, if anyone's interested in reading a well-written but dense white paper outlining the ideas. Right. And the tagline for the ICDA is maps to mechanisms to medicine. And what that means is, if we study enough people who have some disease condition or don't have it, who are surprisingly healthy or surprisingly unhealthy, and learn enough about them, we can start to map out, hey, look, this seems to happen an awful lot with that, right? This genetic variant that these families have seems to be correlated with an increased or a decreased risk of that. And you start to find that. So that's just mapping things out. That's just observing. Hey, look, I get wet more often when the sky is gray. Interesting. And then you go from that to mechanism. You then say, oh, okay, given that correlation, maybe we can figure out that what's going on here is this particular chemical pathway is affected by these genetic changes in these people, and that's why they end up getting sicker or less sick than other people. It's like, maybe the reason I get wet when the sky is gray is water falls from the sky, right? It's like, there's a hypothesis, right? You start to do that. So that's maps to mechanism. And then you go to medicine and say, now that we understand it, let's do something about it, right? Now that we understand, here's this complicated chemical pathway that in some people accidentally makes them healthier or sicker.
Right.
Maybe I could build a drug that does that for everyone else or blocks that for everyone else, depending. Right. So you start with, let's just get a bunch of data. Then you say, now I can start to understand what's actually happening under the covers. And now I can get in there and intervene. So, if I get wet because water falls from the sky, maybe I could put a semicircular cover over my head when I go outside, and that might keep me dry. Right?
Genius, quick, patent it before somebody else steals the idea.
So that general notion is one that has been applied very successfully. There's a well-known category of cholesterol-lowering drugs that was discovered because they found a few people that were accidentally lucky to inherit very low cholesterol. And it's like, well, let's figure out what's going on. Okay, we see what chemical path. Maybe we could build a drug that like that. Right. So that pattern has been proven true in small ways, and I expect to see many more examples of it going forward. What that means is with COVID, people are starting to run the study. There's a COVID-19 host genetics initiative, they call it. It's an interesting perspective. What do you mean by host? Well, we are the hosts for the virus. Right. And there's a lot of people studying viral genetics, which is say, let's look at each of these, if you get sick and I get sick, let's compare our viruses and see if they're the same or different and how we can learn about that. But we could also look at the host genetics and say, if you get sick and I get sick, let's compare our genomes. We'd be interesting because we share a lot of genes. If we had very different outcomes, we'd look at the differences and say, hey, does that mean something?
So it is interesting because it does seem like it would map out because there are people who get sick but don't get sick, and that if there are specific differences in those people to the people who get sick and get very sick,
that's right.
You've got that same kind of. What it reminds me of is, but years ago I worked with Dr. Richard Bandler, the guy who created NLP, and one of the things that he was famous for was developing a pretty damn reliable phobia cure. But the way he did it, which not a lot of people know, is he went out and started interviewing people who had spontaneously gotten over phobias. And he was looking for, do they have, anything in common? And his data set was, I think, 100 people. Like that was where he said it. And he saw enough to kind of find a pattern that he then, used as the treatment, which is the same kind of logic. So I guess, okay. I got so many questions. All right, let's go one more down the COVID line, and then I want to go more abstract. And this is a stupid question, but I'm going to ask it anyways. So how hopeful should we be?
You mean in the billion years before the sun explodes, or in the
or by the time Maisie goes off to college in the fall? But let's split the difference.
Somewhere in between there. Yeah. So first, that is not my area of expertise. Back to knowing what we're good at and what we're not good at. So
No.
I consider myself a above average reader of the opinions from the experts.
Right.
But only that, no more than that.
Okay.
Personally, and I also will add the caveat that I think most of that answer is a Rorschach test on the person you're asking, because there's not enough data to actually give a precise answer.
Right.
I think that the areas that we're seeing the quickest results on, which aren't surprising, are treatments, which are already starting to mean that the likely outcome if you get sick is getting better if you live in an area that has decent healthcare and isn't overwhelmed, right? So that's already kicking in, and there are new applications of existing drugs that people are finding that actually make a difference. There's more understanding of what to treat, what complications to look out for, how to look out for them. So some of the curves that show hospitalizations increasing in very scary ways, but death rates not increasing as quickly as hospitalizations. That's kind of encouraging, right? That suggests that it's starting, because so I think that we should be encouraged by. I think the work on vaccines is happening at an amazingly fast pace compared to the norm, and I think we will, the quote I saw from Dr. Francis Collins, who runs the National Institutes of Health, I think earlier this week, was spot on, which is he's cautiously optimistic that we will have one or more vaccines that do something good early next year. And that feels right to me. The number of different people in different countries who aren't all doing the same thing, but are doing reasonable, similar things, means pretty good odds something will happen. No one yet knows how effective that'll be. But the combination of some amount of, even in bad years when the flu vaccine isn't that effective, it cuts the number of flu cases in half, say, right? Add that to better treatment, add that, so I think we should be hopeful.
Okay, cool. So that leads me to a slightly more abstract question, which is, as a layperson, and I don't know if you quite qualify as a layperson, but in some ways you are. Like, how would you tell somebody to navigate the data reports online? Because it is like, I wake up every morning and I got the New York Times alert, and it shows me today's death toll, and that's just my own kind of self-torture. But I'm aware that I can then go on another site and hear a completely different set of data that seems to be indicating something different, and I don't really have a way of navigating that other than going, wow, there's a lot of data.
Yeah. Well, I think the first question I'd say is, why do you care? And that's important, because different people will have different answers to that. Yeah. And if you care as entertainment, then who cares, right? Like, hey, look, somebody's yelling about something to somebody else. Cool. If you care, because you are trying to make a decision about what you do tomorrow, I think you'll try. I don't think you're going to find that, right? I think that data isn't out there that will actually give you individual advice today. Right. If you care because you're a public health official, well, then there's, hopefully you have better sources than me to help you distill it down. And there's very, so like that, I care because, partly just general interest and partly because it affects me, right? And I want to feel in control of something I'm not in control of. So second best is, well, let me be able to mansplain it. That's a degree of control.
It's a plan.
Yeah, right. So, and I kind of know that, which means I can kind of ration how much time I put into it, knowing what I am very unlikely to get if I were to do nothing but read. Yeah. So that's the first question, is why do you care? Yeah. Second is, I think there's a few just confounders that I just try to ignore and just quickly get past. First is anyone where it's obvious that they're using the data to make a point. They have an agenda.
Right.
And there's unfortunately way too much of that, right? There's way too much of the data that is conflated with someone's agenda, and it's too bad, but not surprising. And try to pay less attention to that. Second is, this is a really simple one, but it's one that the biggest headlines seem to always get wrong, is people who ignore the denominator, right? I don't care how many people got sick in Florida versus Iowa. I care about what percentage of Florida is getting sick and what percentage of Iowa is getting sick. And that is rarely the headline number. The headline numbers are the biggest numbers they can find. Right. It's like, look how bad things are in the United States. Look how bad things are in California and Texas. Well, those are one of the biggest countries and two of the biggest states. So of course those numbers are big. Right. And it means that it's not only that those are misleading numbers, it means that they hide the fact that there might be some really important signals when you divide. So that's the first just number thing, is look for the sites that give you per capita, that give you something to put the number into some kind of context. And then look for the sites that give you more than one number, because there isn't one number, right? This is not, you don't want the dashboard of your car that has a speedometer, and that's kind of about it, except for a couple of idiot lights that light up if something really bad's going on. You really, if you care, want something more akin to the dashboard of a 747, right, which is a little harder to understand, but that's because it all matters.
Right.
So that's there's some things. So those are on the numbers side. The other place is the scientific news, where it's like, new report finds that, new study shows that. Yeah. And there's some really interesting and novel stuff coming out there in a flood of other stuff. Right. And I think one of the good things that's been happening is people are releasing research early, right? Mm-hmm. Before it has yet gone through the vetting process. That's a good thing if it's well enough labeled and people know how to deal with it. People know what to do with that. So there's a difference between a press release and it's like, maybe in order. It's like, there's an article in the popular press summarizing a press release about a new finding. Okay, right. That's one level. Yeah. Then there's a press release from the researchers at the organization summarizing the finding. That's probably a little bit closer. Then there's the preprint, where they've published on probably medRxiv or bioRxiv, which are the sites that if you click it through, you will find yourself on one of those sites where there's the actual paper. And then there's hey, this has gone through the peer review process and the vetting process, and it's out there in Nature or Science or Cell or JAMA or one of the reputable journals, and know which is which, right? It's not don't pay attention to the earlier stuff, but recognize that a lot of the earlier stuff isn't going to hold up. Right.
That makes a lot of sense, because there are a lot of reports, right? And they've started to remind me of, do you remember the old, I think it was Trident? 4 out of 5 dentists surveyed recommend sugarless gum for their patients who chew gum. And I'm thinking, yeah, so if you picked 5 dentists, well, you've got 4 of them saying, yeah, sugarless gum's better than this horror. So it's whenever I see one that goes, doctors say, I'm like,
yeah. And if you do, if your answer to why do I care leaves you feeling I care enough to actually try to dig through it, well, then when you click through, get to the paper, right? And at least find in the paper where they say how many people or patients or data point, what was N, capital N is the jargon, right? But was this a study based on 5 dentists where 4 out of 5 said something, or 5,000 dentists where 4,000 out of 5,000 said something?
Well, so then that actually takes us to an interesting question, which is like, how many is enough? At what point does it become useful data as opposed to just data?
Yeah. Have we ever talked about p-values?
Not that I remember.
Okay. Have you ever talked about green jelly beans?
I'm often drunk when we're together, David. I don't know. Talk to me about p-values and green jelly beans.
All right. So So the question that you're asking is actually, has been studied a lot, is what size N matters? When is enough enough?
Right.
And there isn't a simple answer, but there's a good way to think about it. And it's basically, how likely am I to be kidding myself is what you're trying to do.
Yeah, there you go.
There's a comic strip, a kind of geeky comic strip out there called XKCD, and it's often the case that if you're trying to make some obscure point about math or science or something like that, there is an XKCD that makes it better than you can. And there is one on green jelly beans, and so I will summarize.
Okay.
The work of Randall Munroe, the cartoonist. Yeah. So the plot line in the strip is someone comes in and says, "Hey, I hear that jelly beans cause acne," and they say, "Okay, let's get some scientists to check it out." So the scientists do a study and say, "Nope, we can't find a correlation." Right? So they say, and then the first person comes in and says, "Well, it's actually it depends on what color, right? It's not that all jelly beans cause acne." Right. Oh, okay, scientists, let's do that. So the scientists study whether red jelly beans cause acne, and they find that they find that doesn't look like it, and the odds that we were wrong, meaning that the odds that anything we found was random, were more than 5%. So not meaningful. And then they try yellow, more than 5%. Then they try orange, and so so on. They get to green. It's like, hey, look, odds of less than 5% that this is bogus data. Green jelly beans cause acne, and they keep going. They test 20 colors,
right? And
at the end of testing 20 colors, they find that only one of them shows that the odds are actually better than. So the headline is green jelly beans cause acne. Well, what you've actually found is if you roll a 20-sided die 20 times, you'll get 7 one time.
Yeah.
So if you run enough experiments looking for something that only happens randomly sometimes, it'll happen randomly sometimes. So that's the general idea. The notion of a p-value is how likely is it that the thing we measured would have happened randomly.
Yeah.
So for example, if let's just say I give you a coin to toss, right? And I say, I predict it's going to come up heads, and you toss it and it comes up heads. Mm-hmm. You say, wow, how did you predict the future? You say, no, you could have been a monkey and had a 50-50 chance. So the p-value of that result is 0.5, which is terrible because it's a 50%, right? If I predict that when you flip that coin 10 times, it's going to come up heads each of the 10 times, and it does, you're going to be a lot more interested than that, right? That's going to be, hey, that looks like a much more significant result.
Right.
The p-value is a mathematical way to measure significance, and then it's just statistics to say how you calculate it. And it's one of the things that you learn to be very careful about when you're working with data. And it's one of the things that tells you how many people you have to study, and it's one of the things that tells you how strong a result is likely to count, and things like that.
Did you ever read Fooled by Randomness? Nicholas Nassim Taleb, the economist?
I don't think so. I've heard of it, but I don't think I've read it.
That was where I first was introduced to. He talks a lot about that. It was interesting. So I want to get in a couple more things while we're together. So one of the things that we talked about briefly when we talked ahead of time was about big numbers and small numbers.
Oh yeah.
Yeah. Can you just kind of speak to that? Because again, it's just interesting because for most of us, we don't think about numbers. It's like, it's a number, like it's a big number, it's a small number, but we don't have a framework for thinking about it.
Yeah, I think we as humans are naturally good at working with numbers that have made sense for us to be good at for the history of humanity. Right. So being able to say, hey, it looks like 5 wolves went into the cave and 4 wolves came out. That's a really useful skill for us to have, right? Or being able to like look at the herd of antelope and look at the size of the number of hunters we have and decide if things are going to work out and if we're going to feed the tribe or not. That's really useful. So we're pretty good at intuition around numbers.
Right.
We are not very good at intuition around very big numbers and very small numbers because they rarely directly matter. Right. So, if someone says that, you have a 0.1% chance of contracting COVID, and then they say, actually, it's 0.01%. Those don't feel very different to you. That's a 10 times difference in risk. That's massive.
Right.
But, it's like, well, how do I act differently between 0.1% and 0.01%? I don't know, right?
Right.
And, how should we feel about, 100,000 deaths versus 200,000 deaths? It's a lot harder for us to know than to know the difference between one person we know and two people we know, right? Like those, we are.
No, it feels completely different, even just as you're saying it.
Exactly. So then when you combine those two things and say, so we have a population of 300 million people, and if we take this action, then that will lower the odds of people getting sick from 0.1% to 0.08%. Is that a good idea? It'll cost us $20 million to do it. Is it still a good idea? No idea, right? I have to sit down. I have to do not hard math, but I have to actually work the numbers.
Right.
So when you get to big numbers and small numbers, the answer is don't trust your intuition. Don't trust anyone's intuition around big numbers and small numbers. In the government spending, they taught the old line about, $1 billion here, $1 billion there. Pretty soon you're talking real money, right? Those are big numbers. We have no intuition for them. And the same is very true of big numbers around public health.
Right. Right. Now, do you have a framework for thinking about big problems? Like, do you have a way of, because you're obviously up for taking them on. So is that just, well, we'll see? Or like, do you have a sort of an approach or an attitude?
That I don't have a cookbook. I don't have, oh, let me pull out the binder. It's, I've got nothing like that. It depends a lot. One part of it is just marinate in it. Just like find people or texts or stories or just absorb, spend some time getting to where you have some language. Asking why before what, before how is a part of it, right? It's like skipping it is so easy for engineers in particular to jump right to, ooh, I know how we could build this really cool thing that sounds like it might matter. Yeah. And that leads to the better mousetrap fallacy, right? It's that if I build a better mousetrap, the world will be the path to my door. That's occasionally true. But in these kind of spaces, really backing off and saying, why do we want to solve things? What are we trying to accomplish? And therefore, what are we going to build to get that done? And then we can get to, and how are we going to get it built?
Right. Yeah. Okay. So is that something that you kind of got back when you were at MIT, or is that something that's just emerged in the years of just being involved in solving big problems or taking on big problems?
I don't think I got that at MIT, although it was probably there. I don't think I was ready to get that. I was much more in the what and the how and the like, hey, here's some neat watchmaking I can do. And look, if I put the spring over here, it'll push the lever.
You were like 12, so in fairness.
No, but I had not. I think I'm sure that these kinds of questions were being well thought about there and then, but that's not what I was paying attention to.
Yeah. So the other thing, and I'll just last couple of questions to kind of bring us towards a close. What it seems to me that you have always been brilliant when I'm trying to explain you to people, which I do from time to time. Yeah, the way I do it is I say, there are people who you spend time with them and you think, wow, they're smart. And when I spend time with you, I usually come away thinking, I'm pretty smart. And it's to do with how you explain things. And I remember reading your thesis years ago on making sense of making sense. And my comment to you was, I thought it was really great, but I was surprised at how few big words there were. It took me an extra month to get them out. Like, how do you go about explaining things like this? Because I know you spend a lot of your time traveling around explaining things like this to people.
Yeah. There's a feedback loop of the best way to learn something is to teach it, that I've found, right? It's like, if I can't explain it to someone, I don't yet understand it as well as I want to understand it.
Right.
It's one thing to be able to repeat the straight ahead line. It's like, oh, I can explain the textbook by walking you through what the textbook read. But then someone asks you a question that wasn't linear, and it's like, oh, wait a second. So that's part of it, right? Is that to be able to explain anything well, you have to understand it. And trying to explain it before you understand it might be a good exercise for you, but don't kid yourself that you're actually, your guinea pig may or may not benefit from helping you.
Right.
So that's the first. The second, and Ben, my son, always makes fun of me for this, but I always look for visual, simple analogies. I always just look for, if I can get the simple picture in my head, everything follows. And I have a pattern I've noticed where I'll often, be in a conversation with someone and I'll scribble something on a whiteboard. And then next week I'll be in a different conversation with someone and I'll scribble almost the same thing on the whiteboard. And the third time I say, okay, I need to build a slide. So then the fourth time I have it, I show them the slide, right? And it's like, at that point, it's close to, hey, there's something here. Here's a building block that I can build on. I'll give you an example from yesterday with Ben. So Ben is studying immunology right now, and he's using me as his guinea pig. So he's helping himself learn immunology by explaining the committee.
Your immune system responds.
And he was explaining a particular thing that the immune system does. And I said, well, why does it do that? And I was trying to figure out, why does your immune system get activated if you get cut? Because your immune system's there to fight off bacteria, right? It's not to fight off knives. Your immune system can't do anything about knives. So why does it bother? And he answered, and I said, oh, okay. So I'm defending the castle. I have this nice big wall around the castle, and I have archers who can fight off enemies. Right. And then I noticed that, and then a bunch of stones fall down from the wall, and there's a hole in the wall. So I get my archers to start shooting at the hole. Is that because I think archers can put stones back in a wall? Is that because I think archers can fight off earthquakes? No, it's because I think it's reasonably likely that when there's a hole in the wall, some enemies will come through, and I want to stop them before they get through the hole. And that's why our immune system, that's designed to fight off microbes, gets activated when you get cut, because why not protect yourself from those microbes before they get in? So there's I learned something really interesting about our immune system, but to make it stick for me, I had to have a medieval fantasy novel running. I
think you could turn that into a slide. David, it has been an absolute pleasure. I know we had talking about the ethics of data and stuff like that, but maybe we can do this again another time and go there. But thank you so much, all of you. Thank you so much for being with us. Until next time, I hope it helped. Probably didn't hurt.
It was fun.
Bye, everyone.
Bye.